Hello, my name is Manu Sanchetti. I'm a thoracic surgeon here at Emory St. Joseph's Hospital, Associate Professor at the Emory School of Medicine, and the Director of Robotic Thoracic Surgery for Emory Healthcare. What I wanted to shoot this video today for is more or less a tutorial on how we implemented our Ion program into our hybrid suite, specifically implementing it with the Artis Pheno cone beam CT, using that during our procedures to help with localization and accuracy of our Ion procedures. So starting out, I wanted to talk about our room setup. Number one, as your program goes through its learning curve, what I would suggest is have your team put together some sort of workflow or checklist that helps you for every case. And that's something that we did as we gained more experience. In our room setup, as you saw with the camera pan, we have the setup for the bed at left 30 degrees, and that's primarily due to where our cone beam CT is in relation to the bed. That's something that may be different for your specific setup, but it's something that you have to work through with your team. But make sure you write that down once you figure that out. The next thing that's important is that you place the patient all the way at the edge of the bed, leaving their head all the way to the end of the bed to allow room for the cone beam spin to occur. Next, we found it best if you have the endotracheal tube more towards the left side of the mouth in our experience. So have the anesthesiologist tape it towards the left side of the mouth. Those are the main things to do from a setup perspective. Okay, once you get the room set up the way you want it to, the next thing to do is bring your cone beam CT and do your ISO center. So our interventional radiology technicians will bring the cone beam into place. And make sure while this is doing that you're checking your spaces to make sure everything is clear, anesthesia is clear, your console for the Ion's clear. Obviously the Ion itself, if it's sitting in this space, is clear. So after you do the AP ISO center, you're going to do your lateral ISO center. Again, make sure you're watching everything in the process. Okay, so once it's that in position, you're going to take another fluoro shot. Again, you want to put your lesion in the middle 2/3 of this ISO center. Once that's done, you're set up to prepare for your spin. So you'll go back to AP at this position. And then you're going to go fully RAO 90. So this represents the most extreme lateral to the right position this cone beam CT is going to be. One thing I want to point out before we talk about doing or docking the robot and doing your test spin is that if you notice around the base of our Ion, we have this caution tape. And we found through our experience that putting the Ion in that position is the safest place and the best place to have it, so we marked it out. Along with your workflow, I do recommend once you figure out your room setup and how things work for you, make sure you mark it out so you know where it's going to be next time. So next step, once you have the C-arm in RAO 90 and its most extreme, you're going to go ahead and dock your Ion at this point. Now this can be a little bit awkward because you're sort of tucked in here behind everything depending on your room setup, but you're pretty much going to want your Ion to be close to horizontal, and make sure that you're not banging into anything. So you bring this pretty much close to horizontal, and again you want that ET tube towards the left side of the patient's mouth. And again, because you're at your extreme, if nothing is hitting now, then it's not going to hit when you actually do your spin. Occasionally we found a benefit in putting an accordion or something on this to take off some of the tension from the endotracheal tube. It really just depends on your specific setup to make sure you have a tight docking right here. So again, you're going to want to have this ion essentially close to horizontal, making sure everything is clear all around it, because this is where your test spin, or where your spin is going to be for your cone beam. So we're clear here, and then we dock it. Occasionally an accordion will be helpful if you're having a lot of tension issues here, bending this back. You can put an accordion to take some of the pressure off. So after you have the ion docked appropriately, you can go ahead and do your ion procedure. So put the catheter guide down, put the catheter down, get the catheter where you want it, and then you can do your spin to confirm that the catheter is in the place where you want to do your biopsy or place fiducial or whatever the case may be. When we do our test spins, we do ask the anesthesiologist to Valsalva and hold with pressure, and obviously really the only person that's going to be back there is one anesthesiologist. Everybody else will be out of the way, and then we'll go ahead with our test spin. So as you saw, the test spin goes all the way around. We make sure during that process that nothing is hitting all the joints, the anesthesia equipment, obviously the ion as well, and then most importantly the patient. Once that's done, that's the test spin. Then we can go to the real spin that will send the images over to the computer for us to view. Go ahead. Okay, and so that's that. As you can see, it moves pretty fast, and it can be quite nerve-wracking during the actual procedure, but the reason we wanted to put this video together is through our experience, we found a safe way to do that. But as long as you go through your appropriate steps and making sure everything is clear, out of the way, you can do those spins very carefully and successfully. And they've been very helpful in identifying to make sure that the catheter is in the appropriate position, and really helps your accuracy in performing these procedures. As long as you don't move the ion itself, you don't move the bed, you don't move anything else, you can do as many spins as you'd like. So you can move the catheter somewhere to another lesion if you have one, or if you don't like where it was, and you can spin again if you need to. Thank you for viewing this video with us. Hopefully it's been real helpful for you to understand how to use the cone beam CT in your ion procedures. Please feel free to reach out to us at any point in time. Your Intuitive rep can reach out to our rep and connect us all, and we can help you in the future. Thanks very much.